Hey guys, what's up? This is Adrian Ortiz with AMO Fitness, and right now we're going to be going over a simple little low back protocol. So I actually have 3 herniated discs, 2 in my low back, 1 in my T-spine, and today I'm going to help you guys get out of pain. So what you're going to need is a ball, a tennis ball, a lacrosse ball, or the best are these TPT trigger point therapy balls you can probably find on Amazon. Just look for trigger point therapy balls. If you need more help, I'll put a link at the end. So take the ball, and we're going to start by putting the ball on the corner of our glutes, right here on the side. Not here, but on the corner. So what we're going to do is I'm going to sit on the ball, hands behind you, outstretched, and I'm going to cross at the ankle and start to roll on that side to side. The glute muscle, the striations go lateral, side to side, not up and down. So side to side, once you get stuck on a spot that kind of hurts, go a little to the left or right of it. Take a big deep breath and try to just relax into it. Again, you can go in little circles, but best is to just go around the sore spot and breathe. You can also put the foot down, and what you can do from there is you can open and close the hip, and in PT we call these clams. Again, if you get on a sore spot, you can open and close the hips. So we're still on the outside corners of our hips, and right now you can see I'm really moving side to side. Now I'm trying to scour areas of stiffness. Again, we're going to do this for about 1 minute on each glute. Okay, so this is just addressing the tissue. If you guys, this is just addressing global tissue. Once it gets really, really clamped down on something, you want a manual therapist to work that out. So after we worked the glute area, next what we're going to do is we're going to work on the high hamstring as close as we can underneath our butt here. So I'm going to place this as close as I can underneath, my foot outstretched, and I'm really going to push down, and I'm going to roll right underneath my glute, the highest part of my hamstring, to right where my glute is. Again, my foot is rotating out, straight, in, and I'm just really moving around. Take my hand and put pressure down. Again, just sliding around. So that's a tissue under and above the glute right next to the low back. Okay, so once that's done, we're going to start working on some mobility. So the first thing that we want to do is get into a very stage 1 groiner, and all that is just getting the foot right outside the hand. I know on a bad back day, I cannot do this. So what you might want to start work on doing is just starting to rock back. Okay, so we can just open up the knees a little bit. Notice my back is nice and flat, and I'm pushing back. I'm not tucking my hips under. I don't want to do that. Keep your back flat and push back as far as you can. You can also start to level this down. Okay, push back and forth. So this is a frog stretch. We want to do this for about 15 to 20 reps. Notice from the back, I'm pushing back. I'm not curling and tucking. I'm pushing back. Almost think like you're tapping your butt to a wall. Okay, and as I can go, I can start getting wider and wider with my toes pointed out. That's really going to address the groin area. Again, breathing in and out. And now I'm going to start doing contractions. I'm actually going to take my shins and drive them into the floor for 10 seconds. I'm really driving right now as hard as I can. Then I'm going to relax, and now I'm going to rock again, seeing if I can get a little bit more range of motion. Okay, just rock back and forth. Again, I want you to grip the ground very hard right now. Grip with your groin. Push your knees, shins, and ankles into the ground right now as hard as you can for a very isometric pause contraction. Now relax and sit deeper into that, back and forth. Excellent. So very slowly, I'm going to bring one foot in. This is how you get out of it. One foot, and then the other foot. Next, we're just going to do some cat-camel. So here, head up, and I'm going to start to pull my belly button up to the ceiling. I want you to press your hands into the ground as hard as you can. The focus here is actually on my shoulder blades, pushing them apart as hard as I can and driving my tailbone into my nose. And then very gently, watch how I'm going to just push my tailbone away. And then I'm going to start to flatten out the mid-back and then push my shoulder blades back and look up. It's very important that you understand the sequencing of your spine. Again, watch. I'm going to tuck my hips first. Hips, 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 vertebrae, mid-back, mid-back, shoulder blades, tuck the chin. We're doing one at a time. Now again, driving your shoulder blades, you should be pushing them apart as hard as you physically can. Breathing. And then one by one, pushing the tailbone back, mid-back, shoulder blades down into the floor, look all the way up, eyes to the ceiling. Okay, again, we want to do about 5 to 10 of these. The last one is this series, is to revisiting that groiner. Again, so I'm going to step. Okay, and all I want you to do is actually grab your foot. If you guys can see here, grab your foot and just start wiggling that hip. I don't want you to move. I just want you to wiggle. If you're looking at my posture from the back, my back is as flat as I can handle. If this is impossible, get up and do this on a couch or something elevated. Just wiggle your hips, again, about 10 to 15 seconds or 10 to 15 reps, whatever feels good if you're more tight. Now what I'm going to start to do is actually shoot myself back and wiggle. Obviously that's getting harder as I start to move myself back, open, and wiggle. Okay, we're going to do the same thing on the other side. So notice when I first step, my shin and my forearm are next to each other. The first set, I'm going to grab onto that foot, wiggle open, good tall posture, shoulders, long neck. This is really working on the hip. The loose hips, strong core, your back won't hurt as much. Now I'm going to shift back a little bit till I feel my high hamstring on the outside. And I'm going to wiggle. So you notice this is very far behind now at this point from the back. I'm away from my forearm. Again, I'm wiggling. Just do what you can. Anytime there's a pain sensor, please stop and modify. Get onto something higher. Okay, and last but not least, we're going to start with some low squats. I'm actually going to move this foot next to it, and I'm going to pull up. If you cannot get into this deep knee bend, and notice, my back is straight, not tucked under. Hold on to something, maybe a door or anything to help pull you into this deep squat position and work on prying the knees open. Again, if you need assistance, hold on to something, a couch, a table. Maybe you can hold on to the top of a table and just work on pushing your knees out very slowly. Okay, again, if you might have to do this from this position. Okay, the key is that you are moving those hips out and in. Okay, you can also assist yourself with your elbows for more range, and you can actually work on keeping yourself from coming in. That's some extra work there. But again,